Hello, my name is Jill Berry Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today we're going to be talking about NMC's most wired status. I'm excited to hear about that, and I'm sure you are. And we have with us Joel Benware, who's NMC's Chief Information, Innovation, and Compliance Officer. And also with us today is Dennis Boucher, who is our Information Systems Operations Manager. So thank you both for being here. I know we're going to talk about a lot more, but what we want to start off with is really knowing who you are, because I'm not sure if you've been on the show before, but it'd be great for the community to know who you are in your roles and how long you've been at NMC, and then we'll jump in to what is the most wired status.
Great, thank you, Jill. Again, my name is Joel Benware. I'm the Chief Information, Innovation, and Compliance Officer at Northwestern Medical Center. It's been my pleasure to serve here for the past 4.5 years. In my division, I do have information systems, as well as health information management and the quality department.
Fantastic.
Likewise, thanks for having me this morning, Jill. Dennis Boucher. I've been with NMC now for coming up on 14 years.
Wow.
Various roles in IT throughout, but the last 6 or 7 now as operations manager, so responsible for everything that has lights and plugs into the wall and telephones and all that good stuff.
Thank you both. And we'll get to talk a little bit maybe about your team, but it's really, your leadership has been really amazing. And as I've been at the hospital for 8 years, the evolution of information systems has been remarkable. So thank you for your leadership.
Thank you.
So because of your leadership and a great team, you've achieved a most wired status. And so what does that mean?
Sure, the most wired award or designation is offered by the American Hospital Association. It's a benchmarking tool. So they have over 2,500 hospitals across the country that participate in this survey. We've completed it for 3 years in a row. We've won the award the last 2 years. And it's a great tool that looks at our whole landscape of technology, from our electronic medical record system to security, to our phones, to our business analytical tools. And it puts us at the top of the pile. We're very proud of what we achieved, and it shows that we have a balanced scorecard in all areas of technology.
Can't add much to that. What we've been stressing too, though, is this is not just an IT award. This is a hospital award.
Yeah.
And it's such a big endeavor. It involves everybody in the organization to earn this award, and couldn't do it without any other players as well.
Sure. So 2 years. So when you look from 1 year to the next, is it kind of the same thing, or do you have to change? Do you have to evolve? So what was the difference between year 2 and 3 to maintain that status?
That's a good question. The bar continually rises each year, so it's harder each year to get it. So we want to make sure we're on a good program and have a good technology plan at the hospital to make sure we're achieving these new milestones. Things like the electronic medical record can't be misunderstood. We're constantly evolving our medical record there. This past year, we've moved our emergency department onto our main electronic medical record system. This is key for patient safety and for our providers and nursing staff throughout the hospital, that when a patient comes in the emergency room, that their medical record carries through to the inpatient units. It seems obvious that it should, but the systems in the past have never been created that way. So we're actually the first hospital in the country to go live with our emergency department on the same system as our inpatient medical record. So again, as Dennis said, this is not just a technology award, this is a hospital award, because this took a lot of providers and a lot of nursing time to build this system and integrate it with the rest of the hospital.
You know, I think that's one of the questions our patients ask is, why do I have to keep answering these questions? And so can you describe a little bit about this journey of integration, so that when a patient starts somewhere, whether it's a physician's office or in the emergency department, how are we doing on this connectiveness for our community and the path that they're taking? So what they're taking, the electronic health record, is moving along with them in an integrated way. So how are we doing on that journey, and what do we have left to go?
Very good. So again, the electronic medical record system, there's always been best of breed systems, so specific to the emergency department, specific to outpatient systems, or specific to inpatient. And now these EMRs are coming together as a one system approach. And Northwestern Medical Center, we put in our technology plan that we would get to one system, so that you'd not ask the same questions over and over again. So the emergency department was the first item on that list. And next will be our physician services practices. And we're going to start working on that project this March. We're going to take code, and our employees will be building the system for the next year. So March 2019, we expect to be live on one EMR. So there should be just one registration process, and the medical record flows through the entire organization.
That will bring happiness to our patients and community. Have that one record.
Exactly right.
It really makes things much more efficient for our staff as well. So
Sure. So everything talks to each other. The ED talks to the lab, that talks to X-ray, that talks to the inpatient, and that whole journey. So what else is new in information technology? That certainly you don't have boring positions, that's for sure. You're on the cutting edge. So what else is happening in information technology?
We're pretty excited about our new patient app. Again, by going onto one electronic medical record system, and now allows us to offer a patient app. And we're beta testing this right now with our own employees to make sure the login is seamless and people are accessing their medical record information through their mobile phone. So this is a great extension of technology to our consumers. We're always looking to build a relationship with the public that we serve and making sure they have access to their medical record information. So my team, we've been testing out this patient app. It's been working out really well. We should have a marketing campaign around it at the start of the new year.
Fantastic. Now, what can they get on the portal now? Because I just want to remind folks that portal is there, because we wait for the letter in the mail, and what can they get on the portal, and when can they get it?
Exactly right. So through your home computer or your laptop, right now we do have a patient portal that you can log into and access your medical records, which would have your lab results, your radiology results, and your physician notes. So that's available to people now, and if they're interested in knowing how to access that, they can certainly contact the hospital, and our Health Information Management Department will help them access that. The patient app will just be an extension of that, so it's just a quick app on your phone. With the press of a button, you should be able to access all that as well. And it's in real time. As soon as our lab results are available, they're available on the app or the portal.
Oh, that's fantastic. I think that's a huge resource, and where we all are having a handheld to be able to have that, I think that's really important for us to do. So I've heard about Clockwise and use of that for urgent care. Where is that going? I understand there might be some expansion of that.
Yeah, we're going to be expanding the Clockwise product. For folks that are familiar with it, it's a kind of a pre-registration tool that you can find the links on our northwesternmedicalcenter.org website. It kind of helps you to see if there's anybody in front of you in the queue at the urgent cares.
Yes.
It was where we started the use of Clockwise, and we're going to expand that into the lab now. So if you're at home and you need to have blood drawn, you'll be able to go in, use Clockwise to see how many folks are ahead of you and kind of plan your day around that, and you can pre-register, and the Clockwise will let you know what time to show up at the lab so that you can walk in, have your procedure, and be able to leave and not be waiting in a waiting room. So it allows you to kind of wait at home in the waiting room. So that we hope to see that on November 20th when we open our new medical office building. That's where we'll start seeing Clockwise in use for the lab.
Okay. So to describe our viewers again, so they can go on our website, northwesternmedicalcenter.org, and there will be a clock or Clockwise. How would they find that?
Yeah, there's a link that's very prominent at the bottom of the screen when you go to the urgent care site or link, and it tells you exactly what the wait times are. You'll start to be seeing the lab information there as well when we open up on November 20th.
So go to our website, northwesternmedicalcenter.org. You'll see a link for the urgent care, and you can actually plan your urgent care visit. You can wait in your living room, and folks hopefully should know about that already. And then we're going to add lab. And your waiting time, you'll be able to go in and see if there's other people ahead of you, and you can plan your day. I think that's really cool for the community to know that we're trying to use their day more efficiently and value their time.
Yeah, and there is an app as well, so if you want to put that on your mobile device and have that, so as you run errands throughout the day, you can monitor where you are in line. Our lines are typically pretty short, so probably the amount of time it takes you to drive from home.
Certainly.
Be all set,
so there is a Clockwise app.
Yes,
as well. Okay, perfect. We love our apps, don't we?
Well, anything we can do in our technology program that extends the walls of the hospital, and we try to reach the public as much as we can. So we're constantly thinking about how the end user will use the technology to better interact with the hospital.
Yeah, that's fantastic. So thank you for doing that, because that ease of access is what we want to be all about, so appreciate that. So ease of access of using services and getting information brings to my mind security. So if we've got all this ease of access, then how are we protecting patient information? And so how is security evolving around information systems?
Certainly, that's a big topic, obviously, in the industry, in the world these days. I don't think a night goes by that you don't see a different organization that doesn't get hacked or have ransomware, things of that nature. We have not experienced that at Northwestern Medical Center. We try to follow the top protocols around security. We constantly have third-party assessments of our technology. We keep all of our data encrypted at rest, and we back up all of our systems off-site in the cloud with different vendors. And that data is also encrypted in transmission and at rest at their sites as well. Dennis and his team do a tremendous job at security. And they take a defense in depth approach, which means they use multiple layers of technology from multiple vendors to constantly assess our risks.
Yeah. We also layer in the people and the processes as well. So we have a pretty extensive campaign going on right now where we're educating our staff with very targeted training sessions. One of our staff, Larry King, is doing a great job in presenting material to help staff understand, when you get an email that just doesn't look quite right, what not to do, what not clicking on links and that sort of thing, or the phishing scams and the ransomware threats. So he's doing a great job in helping get that message out to our staff so that we're protecting our network that way. And then we also, as Joel mentioned, have third-party vendors that help us with our processes and making sure that we're following all the best practices. So we're constantly patching servers and managing our end devices, encrypting end devices, and doing all those things as well.
Wow. So I know our time is closing in on us. We could talk for a long time about all of the work that you're doing and what's happening at the provider level. I understand you've got some new innovative things happening for the providers as well, so monitorings and alarms.
Yeah, we do. We have a new product that we're actually installing right now as we speak that will help with communication, again, with mobile devices. It's going to give providers a handheld device and nursing handheld devices to improve staff communication, which will in turn improve patient care, patient safety by making sure alarms, nurse call buttons, and that sort of thing can actually be delivered directly to the nurse who's responsible for a room or to a hospitalist who needs to keep closer watch on a patient. So the technology will send alarms from our nurse call system or our patient monitoring systems directly to the handheld. It also help our emergency department and inpatient staff with admissions and discharge process to speed those things up because it's going to improve that communication between folks.
Secure texting is going to be big. We've been using a version of it in the past, but we're going to go to a new platform for secure texting. So if you're in the emergency department, someone comes in with a wound or a rash, and maybe the emergency department physician wants to consult with the dermatologist, to be able to take a picture and send a secure text message to the dermatologist to do a quick evaluation of, do I need to see this patient, or is there some type of treatment the ED provider can choose to provide. That could make the treatment much quicker and more efficient. So secure texting is a great way for our physicians to be able to communicate with each other in a secure fashion.
We're all texting, so I mean, I just think this is so important for the community to hear that, yes, we are using these handhelds, and as quickly as they're doing it, to text a friend, we may be texting information, but behind that is a protection that we can guarantee their safety of their information. Is that fair to say?
It's fair to say. I'd hate to use the word guarantee, but as much as possible, we follow
in
the
this
best
world.
In this world, exactly.
I know. Yeah.
And it does beg the question too, is making sure patients understand that when our staff are using a mobile device and texting, that they're actually performing patient care, that they're not texting their friends and their neighbors and that sort of thing. So we'll work a lot of scripting around that to make sure that patients understand what's really happening there.
That's true. So if someone's texting, they may not be texting a friend. They may be actually texting important information about your care in a highly protected way, the best that we can. Because you do hear about the external environment, all of these issues about breaking into systems. So it's nice to know that we not only have local, but we also have outside resources that are really wrapping around our safety and monitoring us and auditing us to make sure we're at the highest level of our game for patient information protection.
That's exactly right.
Well, this has been wonderful. Thank you both for being here. Congratulations to you and your team on 2 years. I can see you're setting your sights on the third year by just what you're describing. So thank you so much for being here, and congratulations. And I'm so impressed and proud of the team and your leadership. So thank you.
It's our pleasure.
Thank you, Jill.
I'm Jill Berry Bowen, CEO of Northwestern Medical Center, and your host of the Health Beat Show. And it's so wonderful to hear about our progress on innovation around information systems, but also safety and security is so very, very important. Thank you for joining us today.